Dr. Rahel Klapheke with Parker's Paws Animal Hospital. I'm going to show you how to administer subcutaneous fluids to a cat today. So you're going to need a couple supplies first. So first you'll need a bag of fluids. You'll take it out of the bag. There's usually, when you open it, there's a little tab here that you'll have to take off. And then you'll also have to inject the IV extension set. It's called IV, but we're using it for subcutaneous. So you want to try to keep this whole area sterile, and then you're going to place it inside the port. So the IV bag has numbers on it. Now if you notice, this is a newer bag, so the fluid line is a little bit higher, but each mark indicates 100 mils. You'll have to see with your vet on how much fluids is appropriate for your pet. Okay, so we're gonna start right here, and Lily is she's going to help me with my demonstration today. She gets 100 mils, so we're gonna go to a little bit less than this one line mark. All right, and so then this is the IV port. Again, we're using it for sub-Q, and you can see the fluid line here. I like to see the fluid line because then you'll be able to easily see the drip that's coming down. And so if you ever want to get this line higher, you just squeeze this port, and if you ever want to get it lower, you place the bag upside down and squeeze the port, and then it goes lower. You want to ensure that the fluid has been primed, the line has been primed. It's not as important to make sure there's no air in the line because we're giving it under the skin, but it's just pretty good practice to try to get all the bubbles out before you administer the fluid. So let me go over just a little bit about the anatomy of the line itself. Sometimes there's two different stoppers. One is this one's really simple. This is closed, this is open, closed, open. And then this is the roller stopper, and then this is open, and then all the way down is closed. It's good practice to make sure both of these are closed before you, when you're storing the line. So when you're getting ready to administer the fluids, you want to make sure both ports are open, and then you're ready to go. So a little trick is to get a coat rack with some hangers on it. You can also get a coat hanger, and there's usually a little hole in your bag. You can place this through the coat hanger, and then you can put it on the coat rack. Another little trick is to go into a bathtub, place your pet either in a laundry basket, or if it's a larger pet, you can put them in the tub, and then you can take this coat hanger and then you can place it onto the curtain rod, and that'll help you with your flow. You always want to start with a new needle. If you always start with a new needle, then you know that the needle is good. So it's just good practice to just start with a new needle. So if you notice on the needle, there is a beveled edge. This is the bevel, and a sharp edge. So you want to try to leave the bevel up. Okay, so we're ready to give Lily her fluid. All right, so you see the white part of the skin here, and all you have to do is put this bevel into the sub-Q part of the skin. And so what I'm going to do is just with my If you're left-handed, this is the way to do it. I'm left-handed. If you're right-handed, you would swap and switch hands. So I gently lift the skin. A lot of people do it this way. I poke myself that way, so I don't do it that way. But what I do is with one hand off to the side, gently lift the skin. With my left hand, I gently go through the dermis, just like that. So you can see only the bevel part is in the skin. And I'm at about a 15 to 20 degree angle with the bag. And so then now I'm in the skin and I felt just a little pop. I'm gonna open both of the ports and then you're gonna see right in here that we have a drip, okay? And you can see it going through the line, okay? And then sometimes if you notice any fluid that's building up around the skin here, you may have your needle go through the other side of the skin. So you just gently either reposition the skin or you start all over again, okay? So now we're flowing, and if you see here, you can see, actually we don't even have a drip anymore. We actually have a really good flow. Now watch this, that's dripping. The higher up that you put the bag, the easier the flow. You can see Lily is tolerating this well. She's a pretty good patient. Not all animals are like this. So that's why if they wiggle or if they don't like that microsecond of the poke, you may want to have someone hold or even giving treats or gently scratch their head like pretty firmly while you're doing the poking. But once the needle's in, it's not uncomfortable at all. Now, as you can see, actually Lily's done. So we're gonna gently take the needle out, okay? A little bit of a leak is normal from the hole, and it can even have a little blood in it. It shouldn't look any darker than cherry Kool-Aid. So you can see that Lily leaks a little bit. And the other thing you can see is she's got this pocket right here. That's normal. She's got a little hunchback here. This can sometimes migrate to the elbow or even the toes. And that can be normal too. But sometimes that can be indicative that they got too many fluids because they didn't absorb them. So if that happens more than a couple times, contact your veterinarian. Again, all this should be under the direction of your veterinarian on how much fluid to give. Fluids can actually be detrimental in some conditions such as cardiac or heart disease. So you never want to do this without the direct supervision and direction of your veterinarian. Good job, Lily. Way to go, baby girl. Good job.